Before we get started, a quick heads up. You might catch a little background noise in this episode, and that's because one of my guests is in a location in Lagos, and sometimes life might be happening in the background, but don't worry about it. This conversation is one that you don't want to miss, and thank you for understanding. Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. Welcome to the Global Public Health Revolution podcast. This episode is a continuation of last episode where we were talking about centering the voices of young people when it comes to global health. Today, we will have a critical conversation that would delve a bit more into comprehensive sexuality education, youth agency in global health. The last episode, we talked to young people from Asia and Europe. This time around, we're turning the spotlight to Africa and Latin America. And I'm joined by two powerful voices, Andrea Covian from Mexico and Aaron Sunday from Nigeria. Thank you for joining us on the podcast today. Hi, Aaron. Hi, Andrea.
Thank you very much, Kemi.
Yeah, thank you very much, Kemi.
So let's dive in. And usually we like to start by getting people to know about our guests. So let me start with you, Andrea. Tell us a bit about yourself and why did you get involved in youth health?
Well, in my case, about youth health, I know it's always like super, super important for everybody to have it. Maybe in my country, it's a little bit complicated to talk to your parents about these topics, but I grew up like on private schools. And even if I didn't have like that information in my house, in my family, I got it from the school. So I think that my generation, we were like pretty much prepared. So that's why I'm interested, because not everybody has these information services in their schools, on public schools, for example. So that's why I think it's really important for the government, for them to teach us everybody in my country and every country.
So you were inspired because you feel there's a lack of information, adequate information for young people. And you raised something important, which we will talk about a bit more when you talk about the fact that young people don't get information even from home or even sometimes from school. Okay, so Aaron, let's come to you. What's your own story when it comes to, this journey on health?
So for me, it comes from a shared experience, losing my parent at the age of 8, and then growing up with my auntie, and later getting diagnosed at the age of 12, knowing well that I lost my parent due to blood transmission to HIV, and struggling through finding my pathway in life in terms of education. Not until I was engaged by an American gun woman, Katie Barrera, who took me up and then decided to start training me. And while with Katie, since she run more like an orphanage home, we see her doing a lot around adolescents and also pediatric education and also access to health, because we have seen medical doctors and other health practitioners come into our homes to come and provide services. And then she also giving us access to interface with the likes of UNICEF and also the government. So at some point, I believe UNICEF took interest in my engagement, knowing well that oftentimes when we're interfacing with them, we always are passionate about the health needs of adolescents and young people, especially those that are orphans. So from that point onwards, they approached me and also felt like how can they support me, and also how can we mobilize other young people to see that we cope the spread of HIV, or we mitigate the impact of HIV among adolescents and young people. Because as at that time, about 18,000 adolescents and young people were infected with HIV but are not placed on treatment. So knowing that this is a huge burden and knowing that every day we are losing lives, for me, I feel it necessitates the fact that we have to still contribute a part. And from then, I think we started doing more of community engagement, more of strengthening structures for youth, and also seeing how to design projects and the rest to see how we reach to them. Apart from also that, I was also diagnosed with TB. You know, TB comes with a lot of complication, yeah, because of the stigma and discrimination associated with it. So that moment, I've watched a friend of mine died before my own very own eyes, and also felt like life is not worth living. I also begin to take a lot of what do you call it? I was overdosing the drugs because I also felt like if my social engagement is disagreed or is not allowed because I have TB, then I don't feel it's also worth it living. So, but at some point, I felt ill. I almost died. But the help of some psychological doctors, and also knowing well that they put me in a pathway to think about my future rather than the present, I was able to regain myself back. And then gradually I finished my treatment course. And then we are done with TB. So I also vow from then that also I don't want to see another young person knowing that I lost my friend. I don't also want to see another young person going through that pathway. For SRHR, I lost my own sister due to childbirth. She had unplanned pregnancy and then she gave birth the first time. And while we were still worried that she gave birth early, she took in again for the same person. And this time around, because she was not properly educated and also then there was not access to comprehensive sexuality education and services, we lost her. And from that moment onward, I also believe we don't need to lose any other young woman.
Wow, Aaron, um, your journey is one that I'm going to stay with you a bit on this because we'll talk about, then I'll go to Andrea. But thank you for sharing your story and your journey, and also for highlighting Grandma Kathy, because the work she does for young people living with HIV in Abuja, Nigeria, I think it's something that needs to be applauded because that's a space where young people are being empowered. And thank you for not giving up on life and taking a chance again to say you want to be here and want to be a voice for young people. And we do appreciate that. We salute that kind of courage because that's why we're having this conversation. All you've had to go through with HIV, with TB, losing your sister. And I think what you have to share and what Andrea have to share is what the world needs to hear and why young people should be at the center, even as we continue to discuss global health. So let me talk to Andrea a bit. Just listening to Aaron and just also your own sharing, it kind of highlights some of the barriers that young people are facing because we've talked about information, we've talked about sexual reproductive health, we've talked about stigma, right? So can you unpack it a bit? Because even last episode, Julian and Victoria highlighted some barriers. And maybe this is a good opportunity to look at what are the similarities with young people globally and where are the differences and what can we do about that? So in your own context, are these same barriers very evident, even mental health issues that were raised in the last episode?
Yeah, totally. I have seen them here in Mexico with my friends, even with my family. Like there's a lack of health information to accessing, and sometimes there's even like they can't afford to pay them, you know. So if they don't pay them, you don't get that information, and you are not aware of what is happening, what could happen. One of my family members, who she got pregnant at the age of 15 years old, and everybody was shocked. I don't know if it was lack of information, lack of protection from their parents and all of that stuff. But yeah, it's something that nowadays I continue seeing with my neighbors, with my social friends, and even with my family. So
What can we do about it? Because the issue of sexual health information and services is it's a big one. And most times it is met with a lot of pushback, maybe from governments, from parents, from stakeholders. But hearing your stories, it tells us that, and that of millions of other young people, what can we do about it? How do we make sure that stakeholders, governments, parents, guardians understand that this is critical and needed for young people?
totally. Well, if I can tattoo here in my here in my face information, I would I would do it. Information, and ask the governments to lower the prices on the protection devices, and yeah, to spread this information to everybody in the country, to everybody. Because yeah, the lack of information, it's the whole big barrier that we are facing today, nowadays.
Aaron, do you want to add to that?
Yeah, so I also believe we need to move from the conventional approach of trying to see that government being the one to drive that process to now seeing where is the primary source of information for an
Mm.
adolescent girl and young woman. It will be from the parents and caregivers. So how are we positioning the caregivers themselves to be more like the mentors, the coach, and also the service providers? If they understand that providing this information to their children, it's not in a way of trying to make the children learn bad or negative things. If they have that understanding, then it promotes a healthier conversation. And that what a typical young girl or a young boy will go outside and discuss with somebody, they will find that confidence to confide in their own parent, because that enabling environment first was established at the family level. Then we can move now to look at a society, which of course we are dealing with, whether both religion, social, and cultural. How are we also engaging some of these different institutions to see how they also understand it from both perspective, that the fact that we are talking about sexual reproductive health for adolescent girls and young women, it's not also affecting their religion commitment, or rather their cultural or traditional commitment, but rather we are only trying to ensure the girl child is able to maximize and reach her full potential, or maybe the adolescent boys and young men. We are also trying to make sure they don't fall out of school and become parents when they are yet to even maximize or reach anywhere in life. And then we can step it up a bit to start begin to look at who are the key players within the sector that are investing resources, or government that are also providing enabling environment and policies. How are they also looking at the importance that while they are there as government, these are the next generation and these are the next future. How can they continue to enforce policy, or also review or ensure that they establish policies that promote access to information and also comprehensive healthcare?
Thank you both. So when you speak, I see a theory of change that needs to start from the family, right? And because because the truth is, parents and guardians are really the custodians of information. Yeah, the school is important, but it starts with the home. And that also brings us to the conversation on comprehensive sexuality education, because we're still seeing high HIV infection rates, high STI rates, and that's something that we need to change. And it starts from educating our parents. So what are some of the ways that we can get parents to understand the importance of sexual and reproductive health information and services, as well as comprehensive sexuality education for young people's health?
We need to build trust. We need to also help them understand that we are not enforcing them to do things that are not appealing, but we are helping them to look from the lens of a caregiver or a parent. What are those necessary information or necessary services that those adolescent girls or young boys need in order to also fulfill and reach their full potential? For instance, at the point of ANC, they don't question when they say they should come for ANC, and that's even before the birth of the child. And even after the birth of the child, they don't also question why they say they should come for immunization. So they should not also feel strange when we begin to say, oh, there is a need for this boy or this girl to be properly educated about their sex and also about who they are in essence. So if the parents are properly engaged and they have this trust, and then they see themselves as the first responder, I believe we will have addressed a lot of things, because oftentimes we come with our own English and then they don't understand it in their own terms. I might say sexuality, and somebody that understand the term will know what I mean. But to a normal parent or caregiver, they might think I'm just trying to spoil their child or get their child to do things that are inappropriate. So also we need to know while we embrace the bigger language, how do we speak to them in the language they understand? many find it easier when you say comprehensive sexual education than sexuality education. So what fits parents, and also we need to be sensitive around both the culture, religion, and also the tradition. That way, we'll be able to break through and relate with them in language and also in context specific to what they will be able to embrace.
I'm happy you raised the issue of language and sensitivity to culture because that's very important. And when you talk about comprehensive sexuality education, comprehensive sexual education, some have even changed it to family life education. Some say it's better if it's called health education. It doesn't matter what you call it, but we just need to make sure that the principles that guide it are there. For example, access to information, right? There even research that shows us that when young people have access to comprehensive sexual education or sexuality education, it helps them to even delay sexual debut because now they are operating from a place of understanding, right? They know, oh, these are the consequences. They know, okay, I shouldn't have unprotected sex, for example. Number two, it's the fact that it also helps with the issue around equality and equity and equipping young people to understand what are the harmful stereotypes that pre-exposes them to, let's say, HIV or gender-based violence, and how can they take care of themselves or address that when it happens. CSE also benefits even parents in terms of how they engage with young people about their body, bodily autonomy, the changes that occur as young people continue to grow. So I'm glad that you're bringing out the issue of building trust with parents, because I think that's somewhere that we lost track a bit. But it's not too late now to go back and try to do that, because we're seeing now that there is an increment of engaging more parents into the discussion. Andrea, what is the situation in Mexico? Is it the same with what Aaron has expressed?
Well, I can say it depends on the case of each family, because we have families who has like not very open, that they are not very open-minded. In my case, my family is open-minded. So even if I learned this information from school, my parents, even if they were shy, even if it was a complicated conversation, they were like, okay, we need to have this conversation with you, Andrea, and we're going to talk to you. I really thank my parents about that, because they actually taught me like a lot. They taught me about their experiences, and that has led me to follow with the information they told me. For example, I will share something to you. Even if I have talked that I need to have everything aligned, everything clean, it happens the same with my relationships. What I mean is that every time that I'm going to have maybe intimacy, I always ask for a sample test to know if that person has any disease. And even in the act, I request them, like, even if it's with shy and everything, I tell them, like, I'm so sorry, but I do really need you to take a shower before we have intimacy. And apart from the sample test. But in other families, I have heard that you can't talk about this with your family. So I invite every family, every parent, every uncle, grandmother, for them to open their minds and to interact with their children, to spread this information, experiences, and everything. It can be a difficult topic to talk, but at the end of the day, it's really important for everybody to reach to this information.
Thank you for sharing. So what I like about your sharing as well is that we see the benefits of having parents who are open to talk to you about whether it's sex or reproductive health or growing up as a young person, and how that is impacting your own agency to make the right decision. So and I just wanted to pull that out because that also feeds into what Aaron was saying. You know, when we build trust with parents, parents will do the job of making sure that young people have the information they need and they understand it. I want to shift gears a bit because we've talked about sexuality education or comprehensive sexual education and sexual reproductive health. But there's also the challenges of services. What is stopping or making it difficult for young people to access the services they need? Let's start with you, Era.
So I will prefer to say we will still fall back to how we are managing demand. When demand for services are not being met, that services will exist and nobody will uptake those services. And oftentimes we have seen where more services are available, and when demands are now being made, then you find out there is shortage or maybe there is cut of supply chain. So we need to
Mm,
balance those two ways, because while young people continue to say there is judgmental attitude when we go to the facility, which is looking at more of the human resource aspect in terms of capacity and competency, and how do we build those capacity for the service providers to be adolescent friendly. We are also
mhm,
seeing that at the grassroots level, not much of the demand about the services exists. It only revolves around few. And even when those demands are being made, and then, okay, you are gain the trust of these young people to take the bold courage to go for the facility, you end up getting there and then no available services. No, or they might tell you, maybe for instance, contraceptive, you might be told that, oh, we have run out of stock out, or maybe condom. You might be told that, oh, we don't have condom anymore. Then at the hem of it, again, one of the root cause, I think, is the poor health seeking behavior. The poor health seeking
mm,
behavior always hindered that access to services. So most times it's not like the service is not there, but young people
mhm,
oftentimes believe, I don't need the service. You need to get the mindset to understand that, okay, we don't want you to get into a high risk level before you think that this service is quite important. But we want to mitigate the earlier burden. But you'll find out the fear of the unknown, even when you say we want you to go and do like maybe HIV test, or maybe go and check
mm,
or do screening for STI, or maybe probably go and check whether you have any, even when you miss your period as a young girl, we say, okay, can you go and
mm,
do pregnancy test? You're scared because you are not ready to accept the outcome of that. So until we fix that behavior, when we fix that behavior aspect of it, and then we fix the supply aspect of it, then we increase demand for those services, then we will begin to see some changes. And we need more champions that will be able to come out and also speak and say, wow, so this is quite important. I have been able to access the service, and I feel it's also appropriate for any young person. That way, we will begin to build more trust from other young people, and they'll begin to also see the need to engage.
I guess that's the reason why we also have you and Andrea speaking on this today, because, yeah, and even Julian and Victoria from the last episode, I think it's safe to say we're not short of youth champions, but we also need more of them to amplify the call. Okay, I want to shift gears a bit now and look at global health as a whole. We know that global health is changing, right? We've been seeing the news, everything that's happening, and some people see it as a good opportunity to transform global health from what it's always been, particularly top to bottom, to now make it bottom up. How can we ensure that young people's voices and demands are not only making trends on TikTok, but they can actually influence policies and decisions? Because part of what we've talked about so far also borders on policies, borders on decision makers, the issue of supply, the issue of availability, accessibility, and affordability. All of that also rests with decision makers. But beyond that, how can we ensure that as global health is changing, young people's voices can actually and should actually influence policies and decisions? Andrea, do you want to start?
Well, in my country, it's common that we make manifestations with cartels and everything. Also, to go to the government, make like reaching out, literally sharing also on social media, like what is happening. Literally on TikTok, recently, I saw that in Latino America, it's as we have a spread of diseases, sexual diseases nowadays. And they're like be careful if you're going to have intimacy with somebody, because nowadays here in, unfortunately, in Latin America, we are having like this, it's like the COVID, like this spread of diseases. So it's very complicated. And adding to that, I invite everybody to know their bodies. And if you realize that if something is happening, like it's not what you are used to, you see that something is not acting normal, reach out to somebody, talk to your friend, talk to your family if you have this connection. But what I would suggest you the most is reach out to a specialist.
A healthcare provider, a clinic.
Yeah, exactly. Yeah, thank you very much. That's what I strongly recommend you if you are noticing that your body is not reacting the way you're used to. So, well, end of the commercial. Right.
That's important. That's not a commercial. That's very key for people to also know where to go to young people. Because Aaron did mention the fact that young people sometimes too don't want to go, but it's important for them to know where to go to if they notice something is up, or even just for prevention purposes. To just go get tested, go do your checks, make sure you're fine. Aaron, still on the topic of how can young people shape policies and decisions. You had the privilege of being on the NGO delegation of the Global Fund, right? Which is a good strategic place for a youth voice to be in. What are your thoughts around this, and how can we make sure young people are shaping policies and decisions?
Okay, so very quickly before I talk about my engagement within the global space, I would just say for young people, we need the will. Any young person that believes, oh, I have the responsibility to also add my voice to shaping changes within my immediate community, then the will needs to be there. Then beyond the will, we need the competency or capacity, because you don't just want to solve a problem you don't understand, or you don't want to influence a policy you don't understand the issue. So, and then we can now move also to the external factors, which happens to be maybe the implementing partners, or maybe the UN agency, or maybe the CVOs or NGOs that also support these young people. How do we also prepare them adequately? How do we ensure that they are well informed? And then, of course, we need to also talk about finding facts, because you don't just appear in a policy level and then you're just trying to make noise, but you're just making noise without being specific and speaking into context of things. So how do we harness evidence to drive some of the key points or some of the recommendations that we are making? And then lastly, when we eventually find ourselves in the space, how do we earn the trust of the government? The trust of everybody at that level is all central around whether you are articulated in your submission, you're honest, and you understand the issues that you are being pushing through for. Having said that, for Global Fund, I will just say it was not also an easy task, and also to say I'm also on the board of United now. So I'm sitting in two global health institutional board. So, and the first, which was Global Fund, when we went there, we were just three young people there, and nobody cares whether you're a young person. Everybody that is there has an interest, and everybody that is there believes you have also reason and capacity and diplomacy like everybody. So nobody is looking at you like a young person. So we struggle at first time, and then knowing well that these are spaces that oftentimes no young people get opportunity to be there. I took it upon myself, met the board chair there, Dr. Gaboruku, told him we can't continue like this. We need our own space where other young people can connect to know what the board is doing. And that was what battered the Global Fund Youth Council today, because he directed me to Peter San, and I met Peter San. Peter directed me to Kate Thompson. And now we have the Global Fund Youth Council. And today the story is different, because Global Fund Youth Council attend Global Fund board meetings. Prior to our board meetings, you will find out they're around. Whatever issues they have, they bring it. And then some of us that sit on the board take it forward for whatever decision that has to be made. And then beyond that again, how do we also position young people within in-country at spaces that they can also add value and also shape their voices? So, for instance, I give you an example with Nigeria. Over time, we have noticed no young person in terms of age was sitting to represent the youth. We led that process and changed that. And today we have two young women that are sitting and representing youth on the CCM. And then at the Africa region also, we do the same effort, the same with the PEFA. We understand that PEFA is a whole different approach entirely, but we also tell them, how do we get young people to be here? How do we also help young people to tell you their needs and all that? And that's how we engage in the COP planning. And we also support young people to always attend COP. And then their priorities are always funded alongside whatever the civil society is being supported. Then you come back to the government. Government have what we call the national technical working groups, or maybe forums and other things. We have to also help them understand. You can't be talking or making decision about a young person when that person is not there. Is you talking on behalf of the person without knowing the needs of that person. And with gradually, we have built that trust. And today the story is different because across different platforms in country and also even within the Africa region, you can see that we have a lot of young people sitting on those spaces. So one thing I would say, capacity is very key. We don't just want to say we are pushing any young person to influence decision, but how prepared. Because when you sit there and everything they discuss there seems to be strange, that person cannot meaningfully engage. And even when he's supposed to support or to go against any policy, or any decision, that person will not be able to do. So we need to look at it and then fact finding. Fact finding is very key so that we are not just making noise, but we are actually seeing things from the aspect of how it is.
Thank you so much, Aaron. Yes, the issue of building the capacity of young people to meaningfully engage in these spaces. And I'm glad they are getting to hear from you as well, as someone who has been in these spaces for a long time. But it's also encouraging young people to take up these spaces, because that's another thing. Young people are powerful. So I hope that as our listeners listen in, especially those who are decision makers and policy makers, key stakeholders, they must remember that young people are also very critical stakeholders when it comes to health. Okay, so let's look ahead. We like to see, we've talked a bit about the past, the present, but what is the future looking like for young people in global health? So what kind of change do you want to see? Andrea talked about, rising cases of infection, even among young people. And you've mentioned some of the challenges as well. What do you want to see? What change do you want to see as the world, forges a new path for global health, particularly for young people?
Well, I want to see a world where young people feel free to inform themselves, to speak out, to know their bodies, to reach out for help, to know that the governments are going to help us, doesn't matter what. That to feel safe about the governments improving all of their hospitals, the public services, the private services. So I want people to feel confident about themselves and for what they are going to see on the outside, pretty much. So, yeah, and for them to demand their own rights.
Thank you so much, Andrea. That's really powerful. Aaron?
So looking ahead for me will just be, how do we get young people to be self-reliant? Because once they are self-reliant, every other thing comes as secondary. Because if we have young people having access to opportunity that would develop them and also make them a contributor, whether in the field of technology, whether in finance, or whether in the development sector, and then they are earning, then we will have solved the problem of maybe user fees at the facility or cost of procurement of some medication. That will have also helped in terms of seeing that they are owning the agency for their own health. And the burden will be lessened from both the government or both the implementing partners who bring resources, because we have a generation that can cater and take care of themselves. Because one of the major things I've always seen is, even when you talk about engaging them in policy and decision making, do they have the resources when some of these meetings are happening to attend? The recent IAS concluded in Kigali. I was a bit disappointed, and I have to raise it to the governing council. When you say young people within the age of 26 or within the age of 27 need to pay $735 for registration, knowing well that in a continent like Africa, we have mass majority of young people still living with their parents, still looking up to their parents to feed them, to shelter them. And even those that have graduated have not yet gotten job. How do you want them to come and add their voices there in country? Also, when you have meetings or you have engagement where their presence is quite required, when they don't have the resources to be there, they will be missing. So moving forward for me will be we need to be deliberate around seeing as the war evolves and funding dwells goes down, how are we deliberate about empowering young people and developing them ahead of the future to sustain themselves?
Thank you so much, Aaron. If we say young people are critical stakeholders, what are we doing to make sure that they are able to meaningfully engage? They can be in the spaces and they can also be trusted. So thank you so much for joining us for this really important conversation. And now I want to go to the part which has become a tradition for us whenever we're ending an episode, and it's to just some fun questions so our listeners get to know you a bit more. I'll start with you, Aaron. If you were stuck in a desert for 48 hours, what three things would you bring with you?
Of course, I'll get a mango, and of course, I'll look for a bush meat. And if it happens that there is any pineapple there, I'll plug it and come along with it.
Oh, so you're just gonna go mangoes, bushmeat, and pineapple. You don't need water in the desert.
I need
But
water,
anyway,
but water is not it. I need to survive.
that's good to know. Okay, Andrea, to you. Name one country on your bucket list, and why would you love to visit that country?
I think it would be Norway because of the golden lakes, the
Mm.
Abriolas. Yeah,
Mm-hmm.
those northern lights, those ones.
Northern Lights,
I
yeah.
do really want to see them. Those ones.
Oh, nice. Okay. And Aaron, road trip or air travel, which do you prefer?
To be honest, for stress, I avoid road, but I love road trip because it gives you opportunity to really connect with nature, and then you get to see the world around you.
All right, fair enough. And Andrea, if you were an ice cream flavor, what would it be? And what would you be and why?
I would be avocado ice cream. It's it's my favorite one. So yeah, I would definitely would be that one.
You
Yeah.
sound very exotic, so that's
Yep.
that's
It
good.
is.
All right, Aaron, what's the last book or article that you read? What was the last book or article you read?
Oh my God, this is kind of tough.
And it's okay if you haven't read anyone in
No,
a while, that's fine.
no, I have couple of them open, but I think top of my head, I'm looking at. I won't call it an article, but the recently
Mhm.
launched WHO guideline on advanced HIV disease.
Okay, awesome. And then Andrea, what was the last movie you watched or you saw?
It was. It is called. It's a series. The new chapters have just came out, and it's Wednesday on
Mm-hmm.
Netflix. So
Oh,
I
nice.
saw that one. It's a good.
That's good. So that's a
Yeah.
recommendation for listeners. And
Oh yeah.
also, yeah, and even Aaron on the WHO guidelines. So, okay, Aaron, let's come back to you. Who's your favorite musician or band? Your favorite musician or band?
So I will just say my favorite musician will be Ice Prince. Ice Prince is a rapper, yeah. It's a Nigerian rapper. And I'm a rapper, so I love his music.
Oh, I didn't know that. So
Um,
can you give us like one or two bars?
so we'll do this
Not
some
to
other
put you
time.
not to put you on the spot, just
Yeah.
kidding. Let's go to Andrea. This is the final question. If you had $100,000 to develop an app for young people, what would you call it and what will that app do?
Oh my God. Okay, that's a good one. Okay, I like it. Maybe it would be something about psychology help for them to speak out their problems and for the app to help them. And I would call it my new best friend I guess
My
my
new
new best
best
friend.
friend.
Yeah,
Okay, so that's nice.
totally.
That's good. Wow, it's been so much fun just talking to the two of you today as we conclude this part series on youth voices. I hope that our listeners hearing young people share their barriers, successes, and vision for a more equitable global health future inspires us all to act, but also to ensure that they're not left behind as we form and shape a new global health architecture. As the saying goes, young people always like to say, nothing for us
Without us.
without us. Thank you so much, Aaron
Thank you
and
very
Andrea.
much.
It's been a pleasure
Thank
having you.
you.
And for me, it is me, Kemi Gbadamosi, signing out. Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.